Medical.
Hello, my name is Jim Jewell, and I'm the owner of In-Home Medical. What I'd like to talk to you today is about how to select the right supplier for your in-home medical equipment needs. We provide medical equipment in the Tri-Cities, Moses Lake, and Pendleton. We will deliver to your home, and we will allow you to come into our store to select the right products if that's what you prefer. Today, however, I'd like to show you exactly how to select the best providers. You want to make sure they have the knowledge, the caring, and the know-how. You want to make sure they educate you on how to use your equipment and that they too can fight for your insurance benefits that you deserve. So I'm going to introduce you to several of our employees and allow them to talk from their heart about the equipment that we provide and the job that they do for you. So whoever you decide to go to for these equipment needs, make sure you at least get that level of service from them as well.
Our heart in it at In-Home Medical.
A critical member of the In-Home Medical team I'd like you to meet is Gladys Gomez, the head of our sleep department. Gladys has been with us for years, but takes her job extremely seriously. And what we're going to do is talk to you specifically about how to pick the right vendor for your sleep apnea needs. Gladys, can you tell us what you would look for if it was your relative that you were about to set up for sleep apnea?
One, we have to make sure our provider has different types of choices as far as their therapy treatment. The PAP device that they're going to use, but also a choice of the mask they're going to use. There has to be a different type of education, not just here's your device. There has to be extreme education and the benefits of using the PAP therapy.
Why do you think it's important they have different machines to choose from?
Everybody has a different view of PAP devices. Is it easy to understand? Is it easy to use? Does it look good?
I remember when you set me up, what was really helpful for me was very different face shape and all those different masks to choose from. Do you see that it's easier to fit people with one type of mask, or do you like to use several masks?
Everybody has a different face structure. It's really important if you are a mouth breather for you to have a full face mask is actually better for mouth breathers. Or if you have panic attacks, not wanting to have anything on your face, then there's different types of masks for you to try out.
What are some of the other health risks that they have to take into account?
Well, it's really important for you to actually treat sleep apnea. Sleep apnea is one of the most common undiagnosed problems out there. There's actually a lot of health issues if you continue to not treat sleep apnea. If there's a risk of high blood pressure, heart attacks, strokes, depression, if sleep apnea is not treated, it leads to a lot of health problems.
What are some symptoms? How would I know if I had sleep apnea?
Some of the symptoms for sleep apnea is excessive daytime sleepiness. Most of the time, your partner or spouse will actually let you know that you have loud snoring or choking or gasping sensations. There's actually a lot of daytime sleepiness, just tired throughout the day. You're not able to function or concentrate throughout the day.
If I suspect I have some of these symptoms, what should I do?
You should contact your primary physician as soon as possible.
Can they tell me in the doctor's office if I have sleep apnea?
They are not able to tell you. They go through a theory of questions and ask you and see if you meet any of those criteria. And then if your doctor suspects that you have sleep apnea, then they'll go ahead and refer you to a sleep technician.
If I came into your store and was just talking to you about it, would you be able to tell me if I had sleep apnea so I could just take the machines home and test them out?
No, unfortunately, we're not able to do that. It's really important for you to actually get diagnosed with sleep apnea and be treated correctly. You have to have certain pressures in order for you to start CPAP therapy.
Does insurance cover this?
Most insurances cover 80%. Most insurances actually cover a sleep study also.
Oh. So what are some of the things, since you've worked for In-Home Medical, what are some stories that you have where you know you made a difference in people's lives?
A lot of the stories that I get, actually, a lot of my customers that I see, they've already taken a lot of medications because of depression or diabetes. And it's really nice to have them come back and have them lose the weight and actually tell me that they stopped taking that medication. So PAP therapy does make a difference in their lives.
We put our heart in it at In-Home Medical.
Rose is going to demonstrate with Alina exactly how we should go about doing a fitting for any customer or any patient who needs a walker or a cane or a lift chair. So first they're going to start with the walker. And Rose, if you could show how you would treat any customer who comes in here so our customers out there or other customers who see this could know what they should demand from other people, I'd sure appreciate it.
A patient comes in with a prescription and they need a walker, a four-wheeled walker. We have quite a few to choose from, different colors and sizes. We let the patient pick one out, that the color or the size that will work for her. Then once they pick out the walker, then they will come back to me and I will adjust that for them. What I have them do is stand into the walker. We're going to measure it at the break of the wrist for her. It's a proper measurement for it. If, put your hands both on, if the walker is, if the handbrakes are down too low, she will stoop over a little bit, and you don't want the patient to do that. If the brakes are, if the handle grips are too high, it'll injure her shoulders. So we want to make sure it's a proper fit at all times. Once we get the fit, they have to lock down the brakes in order, before they sit down, so that the walker doesn't go out from underneath them and have a chance of falling on this. The other ambulatory aid that we have is a cane that patients come in for, and they just need something to help them steady themselves.
When a patient comes in, what we do is we first assess how tall they are, and again, the cane has to meet the person at the break of the wrist, and this is obviously way too high for Rose. So there are knobs right here on the cane, so I'm going to lower, and you can hear the snap of the little button every single time you lower it. And it's still a little bit too tall. We want it to meet Rose right at the break of the wrist. So I'm going to go ahead and lower it a little bit more. And one more. Okay. Now, how does this feel, Rose?
Feels good.
Okay.
Thank you, guys. I really appreciate what you just did. Now I'd like you to demonstrate for our customers how you'd fit a customer for a lift chair. So Alina, if you could fit Rose this time and show her exactly how we would fit a lift chair for any of our customers who come in here, so they'd know what to look for in any vendor they select.
When a customer comes in and they are looking for a lift chair, the first thing we do is fit them. So Rose, go ahead and sit down. And when they sit down, we want to make sure their feet are flat on the floor. So this chair is a little bit big for Rose because her feet are just barely touching the floor. Another thing we look for is that there is some leg space right here behind the back of the knees, and that there is space between the arms and between Rose's thighs. Rose, if you want to go ahead and have the chair help you stand up. The main purpose of a lift chair is to help you stand up. A lot of people have problems with hips and knees, maybe Alzheimer's or other diseases. So this chair helps you get in a standing position and helps you take your first step out of the chair and help you get walking. So there we go. And when a chair is in the up position, a person can just come, lean back towards it, and sit down comfortably instead of just plopping deep down into a chair. And then halfway down, you want to have the person scoot back in so they're comfortable and against the back of the chair. And then we're going to have the bottom recline up. Okay. So this chair can really get someone relaxed. The chairs come in a variety of fabrics, vinyl. We also have leather, a variety of colors. We have several vendors, and we can also custom order chairs to have everyone the chair they want and the size that fits them.
We put our heart in it at In-Home Medical.
At In-Home Medical, one of the services we also provide are for mobility patients. We provide power chairs, scooters, manual wheelchairs. A lot of this comes with an awful lot of technical work, and you need to look for experts. That's why we have Cindy, who works here, and Rocky as well. They've been in this field for many years, and they have lots of experience, and I'd like to have them talk to you next about what you should look for in a provider for your mobility needs. Go ahead, Rocky, if you and Cindy could demonstrate, please.
Okay, well, one of the first things that I would say that you need to look for in a rehab technology supplier is the fact that they're local. They're going to be able to provide service after the sale, because there's a lot of tweaking that goes on in assistive technology that is required. I'm going to sit in this one since this chair fits me pretty good and kind of point out some things that that you'd look for in a manual wheelchair fit and in a power chair fit, but there are some differences, and Cindy just demonstrated one. You should always get into a chair and have it locked so it doesn't roll out from underneath you. This chair actually fits me pretty good. If I turn to the side, you can see that I have good support through the thigh, and the seating system in this is a nice width, so that ergonomically I have good control and nice access to the hand rims. If it's too far out here, if I had a different body style and I had to reach out here, you can see that that would be a disadvantage to propulsion. So I've got a good seating surface. The seat to floor height is pretty good for me. I don't know how this. I'm taking this chair home, Jim. This one's mine. But this actually happens to be one of our local vendors, and they do a nice job of custom chairs. But another thing you look for is the seat width, of course, and the back height. On this one, for an active user, you don't want to. Traditionally, what we used to do is, especially on pediatrics, which is, I think, a no-no, is bury the scapulas. That's those shoulder blades, and they tend to force kids to roll forward. And so on an active user, you want free rotation of those shoulders. So we try to free those up and give them good back support so that the curvature of the body is good. This is the next level of intervention for somebody that doesn't have the ability to propel a manual wheelchair, and this is a power mobility device. It's a scooter. It's a great option for many people. The benefits of it's more portable than a power wheelchair, and it's a lot more fun, a lot more appealing in the way of aesthetics. A lot of people like the looks of this more than a chair, and I can understand that. And it is really very portable, and it's a good option for many people.
And it can be disassembled and put in the trunk of your car, which allows people a lot more freedom than they ever thought they could have.
And it looks cool. And it does have a swivel seat for access in and out. The tiller adjusts. There's lots of different scooters. This is just a Group 2 scooter. There's some scooters out there. I just did one that was with 13-inch wheels so that the lady could do her farming. It was pretty cool. But there's lots of options in the way of power scooters that are available to increase your mobility in access to the community. And the scooter is a good option for that. And Cindy just demonstrated really the number one advantage of a power wheelchair is its maneuverability. For those people that are in tight environments in their apartments or homes, they have narrow doorways, a power wheelchair can be the solution for that person, that individual. It turns on its own axis there, and then you can see that it was very maneuverable. So if you have tight hallways or anything like that, this is often a great solution for that individual. It's manipulated. If somebody has a limited use of their strength in their hands or their arms or their shoulders, this still is a device that they can use to access their home environment and even some of the community environment. The next level of intervention would be a power mobility device, a wheelchair that has multiple function. This one in particular, for those people with a spinal cord injury or a neurological disorder that is progressive, they need something that can be adapted electronically and allow positioning and repositioning abilities. And this one provides that. The nice thing about this chair it has infrared technology that you can use to control some of your environmental controls, change channels on your TV, control lights, turn radios up and down. This one has that ability to do that. This one also has another function. Cindy, you want to demonstrate the tilting on this for us? How this tilts? The advantage of tilt is for those people that don't have the ability to weight shift themselves. They don't have the strength or the function to change their weight-bearing surface. This chair allows them to do that through the joystick. And that's all programmable. The speed of the tilt can be programmed. The ability to short throw this so that if they don't have a great deal of strength, it doesn't take much to do that. And you can see the advantage. They can use gravity to help them. If they're sliding out of the chair, they can use it to help them get back. If they're going down a ramp, it's kind of scary to go down a ramp when you're leaning down, but this allows them to tilt back and go down a ramp at a normal posture while the chair does the ramp for them. Lots of advantages to tilt. Used to be when I first started, there was no tilt, there was just recline. And recline leaves you in a non-functional position, whereas tilt, your visual field can be increased and you can still function in an upright posture and communicate with those around you and access your environment. It's a great product. And we don't, when we evaluate somebody, we don't go in and say, well, this is what we're going to put you into. We let their needs determine what we're looking at for them. And I think that's, any good company would do that instead of just saying, we're going to move this product, we're going to find what works best for you. Anything to add, Cindy?
Just that improperly fit equipment may cause secondary harm, which we all want to prevent. And so the proper fitting by a trained professional is extremely important.
Very important.
We put our heart in it at In-Home Medical.
In-Home Medical was founded over 20 years ago by respiratory therapists, and the cornerstone of our business was good care for our respiratory patients. It is something that we strive to always do and will always do in the future. It is very important to what we do. As part of that, we have a department that's staffed with extremely experienced respiratory therapists. This is Tim and Skeeter, who are in our department currently, and they are going to talk to you about how important it is that your DME provider give you the very best respiratory care if you are an oxygen patient.
In the last 20 years, there have been great strides made to allow patients to live with dignity in their own homes, independently, to be part of the community and a bigger part of their family life. And one of the biggest issues was to provide oxygen in their homes. We have a full line of concentrators and portable equipment so that the patients can travel and go to Johnny's baseball game.
Probably hundreds of thousands of people who used to go in the ER are now at home, and the equipment has become, much like telephones, much smaller, simpler. Tanks are no longer heavy, they're lightweight aluminum. Instead of drawing blood now, we have these small pulse oximeters, as you can see on my finger. Concentrators, oxygen concentrators, used to be the size of this chair. They're now not much bigger than a small television set. It's very simple to use, and trained people like Skeeter and myself and the delivery people can teach almost anyone how to use this equipment efficiently and effectively. And of course, always follow your doctor's order, and you'll find that you can travel and lead a very happy, healthy life a lot longer than before.
One of the most important things that we do here at In-Home Medical is patient education, so they use their equipment the way the physician wants it to be used, and they take their therapy. Tim, why don't you explain about our patient education?
Well, I've enjoyed that because we start with these patients oftentimes in the emergency room, and then we follow them home. We demonstrate the equipment. We ask the patient to demonstrate it back so that they feel very happy and secure with the product that they have. We cover all the safety features. Also, again, work hand in glove with our delivery staff because they're in the home. We work hand in glove with home care nurse so the quality care is achieved. Really the team approach and a multi-level educational approach so that everybody is very secure with the product that they have.
In-Home Medical is on call for our patients 24/7. We pride ourselves on being able to get to the patient and help resolve issues within a very short period of time. So this requires that all of our delivery personnel and even our personnel here in the office know all there is to know about the equipment that we have out there. And oxygen is something that we all require, and we do our best to instruct all of our employees and the patients, and in a lot of cases the home care nurses are part of this, as well as the physicians. We pride ourselves on being the best at what we do, and we will continue to do that. Tim and I have had a lot of experience, and we both do continuing education and take that education to the patients in their homes.
I know when I moved to town here, I looked at different companies to work for, and I chose In-Home Medical because of their multiple stores, because of their history, because of their integrity. And whatever store you choose to go with, you should expect that from any dealer in this industry. Professionalism, cleanliness, education, and just good, proper service, the golden rule. So I'm happy to be here, and I think you'll be happy with our service.
We put our heart in it at In-Home Medical.
In-Home Medical was established in 1988, and I started with them in 1991. So I've been with the company almost the whole time. And one of the things that I think has set us apart from some of the other companies in our area is that we do the in-house billing, and we have our billers here, and we're able to, talk with you in person or on the phone and help you with the different claims that you might have.
And I've been here for 4 years working in the billing, and I really love working here. One of my favorite things to do is when a patient is confused about a billing, they can come in, they can bring all their EOBs for the last 2 years. They're so confused. It is very confusing. I was confused when I first started learning billing. I'm very good at it now, so it's fun to sit down with a patient and explain their EOBs, walk them through the process. We're here to help you. So, and don't be embarrassed, bring it in. It is very confusing, and if you walk out the door, you're confused, you come right on back. I've had that happen several times. It's still very confusing. So we just want you to know we are here for you to work to get your claims paid and to help you understand your benefits and know what the insurance companies will pay for. We're here to help that happen very, very quickly. We're very good at what we do, and we can get your claims paid fast.
We put our heart in it at In-Home Medical.
Okay, at In-Home Medical, we do offer a wide variety of braces. Today we're going to show you the back brace and the wrist splint. This part right here is a removable part to the back brace. It's a panel that's going to go on your stomach to offer more support for your stomach and your back. This part is going to be on your lower back to offer some lumbar support. You're just going to wrap it around. And then go ahead and turn. And then on the back here, you're going to see this panel here to where these strings are. And it has a little tab here that you're going to pull to where you can tighten it to get the proper support that you're looking for.